A warm greetings to all my students. This is your ma'am Usha, and today let us talk a topic under biochemistry. The title of the topic is proteinuria. So, what is the objectives of the topic? So, we have to know regarding what is proteinuria, then causes of proteinuria, and the third objective is types of proteinuria. So, now we have to know regarding what is proteinuria. Normally, the total amount of protein excreted in urine over 24 hours is less than 150 milligram and it is not detected by protein test. In case the presence of protein in urine in excess of this is referred to as proteinuria. Protein in urine. So the terminology we have to know regarding if any protein is present in the urine excessively more than 150 milligram per day, that is considered as a proteinuria. Then an excess protein in urine is suggestive of illness. In case if we see any protein excessively in patient urination, that is a symptom for illness. The protein excreted is mostly albumin and some smaller protein. So whenever we talk regarding proteinuria, which protein is excreted in patient urine? That is most abundantly albumin. With severe proteinuria, general hypoproteinemia can develop, which result in diminished oncotic pressure. We have to understand the concept regarding oncotic pressure. In these cases, there is a identification of diminished oncotic pressure which leads to edematous. Mostly, this is a symptom for kidney inflammation. So let us see what is oncotic pressure. Oncotic pressure, also known as colloidal pressure. When we talk about regarding fluids, there is a two kind of fluids in our body. One type of fluids are colloids. Colloids means blood products. Then another type of fluids are crystalloids. Crystalloids means the normal electrolytes. So in these cases, the oncotic pressure, also known as colloidal osmotic pressure, is the osmotic pressure exerted by proteins, particularly albumin in the bloodstream. So there is this fluids constantly remaining in the blood vessel because of the fluids are managing this oncotic pressure. This pressure helps to maintain the balance of fluids between bloodstream and the tissues by drawing water into the bloodstream from the surrounding tissue. So we have to see the concept of what will happen if there is a diminished oncotic pressure. Diminished oncotic pressure refers to a decrease in osmotic pressure exerted by proteins in the bloodstream. This reduction in oncotic pressure can occur due to various reasons as decreased level of plasma proteins, increased permeability of blood vessel walls, and third one is loss of protein rich fluids from the body. Causes of proteinuria. It can be caused by increased permeability of glomerular membrane. That is considered as a glomerular proteinuria. The second cause is reduced tubular reabsorption. That is considered as a tubular proteinuria. Then third cause is increased concentration of low molecular weight proteins in the plasma. That is known as overload proteinuria. The fourth cause is abnormal secretion of protein from the renal tract. That will be known as post-renal proteinuria. Then another concept is types of proteinuria. In the types of proteinuria, the first one we have to remember regarding glomerular proteinuria. This is the most common and serious type of proteinuria and because most of the excreted protein is albumin. The glomerular proteinuria is often referred as albuminuria. Albumin Is the protein majorly present in the urine in proteinuria cases? That is a no. That is why we consider as a albuminuria. Albumin is present in the urine. That is why the term is given here albuminuria. Then protein in urine is a first sign of glomerular injury. We know the glomerulus, the importance of the glomerulus in the kidney. The glomeruli of kidney are not permeable to plasma proteins and therefore plasma proteins are absent in normal urine. If the patient is not having proteinuria symptom, what will happen here? The kidney is not permeable. The kidney is not allowed to filter the proteins in the urine. In that cases, we can't able to identify protein in the urine. So here we have to know regarding the concept of permeability. Permeability refers to the ability of substance as membrane or material to allow another substance to pass through it. And when glomeruli are damaged and decreased or in disease condition, they become more permeable and plasma proteins may appear in urine. Loss of large amount of plasma albumin in urine result in edematous. This edematous we can identify in patient's hands, feet and face. So what they are telling here? So when there is a loss of large amount of plasma albumin, so in case patient is losing loss large amount of plasma in his urine, there is this development of edematous. This edematous can be identified in the patient hands, feet and face. Then this glomerular proteinuria is seen in which condition? We can identify it in the nephrotic syndrome and diabetic nephropathy due to increased permeability of glomerular membrane. We know the meaning of this nephrotic syndrome. Nephrotic syndrome is indicating a group of signs and symptoms which related to the kidney disease and diabetic nephropathy. What do you mean by this diabetic nephropathy? Diabetic nephropathy means the patient may be having abnormal blood glucose levels. This abnormal blood glucose levels may be damaging the kidney. So that is known as diabetic nephropathy. And the major protein found in glomerular proteinuria is albumin. And excretion of albumin in the range of 30 to 300 milligram per day is known as microalbuminuria. We know the meaning of this. Micro means small amount of albumin is present in the urine in the range of 30 to 300 milligram per day. So that is known as microalbuminuria. Then, this microalbuminuria is the earliest sign of renal damage. Initially, when the kidney is prone to developing any or getting any damage, so initially less amount of protein is identifying in the urine. That is known as microalbuminuria. So it may be factor for due to diabetes mellitus and hypertension. Excretion of albumin more than 300 milligram per day is indicative of significant damage to the glomerular membrane. So we can consider here when there is a presence of protein that is albumin more than 300 milligram per day, it is a symptom for glomerular membrane damage. And in normal pregnancy, urine protein excretion may increase slightly about 300 milligram per. However, more severe proteinuria occurs in preeclamptic toxemia, a condition in pregnancy which is characterized by the abrupt rise in the blood pressure. So this preeclamptic toxemia is a condition which can be identified in the pregnant mothers. In that cases, there is a rising in the blood pressure. Then we can see the definition here. Preeclamptic toxemia, also known as preeclampsia, is a serious pregnancy complication which is characterized by blood pressure, high blood pressure, and it is a sign of damage to another system. The most commonly, the organs are involved are liver and kidneys. It is usually begins after 20 weeks of pregnancy in women whose blood pressure had been normal. Then Another one is functional or benign proteinuria. Is a form of glomerular proteinuria that is probably due to changes of blood flow through the glomeruli. When there is a insufficient blood circulation towards the glomeruli, we may identifying the condition is functional or benign proteinuria. It is seen with certain kind of activities like severe exercise, and then patient may be undergoing the condition of fever and the disease conditions of heart failure and hypertension. Then another type is tubular proteinuria. The tubular proteinuria is characterized by the appearance of low molecular weight proteins in urine due to reduced tubular reabsorption. What is happening here? Tubular proteinuria. The name is indicating tubule. What kind of tubule here? In the nephron, we can see proximal convolutal tubule and distal convolutal tubule. Here, there is a problem is arising. Reduced tubular reabsorption. The tubules are going to failure to reabsorb the proteins. The low molecular weight proteins are excreted in tubular proteinuria. What are they? They may be beta microglobulin and retinol binding protein and lysozyme. Then tubular proteinuria is more commonly associated with glomerular proteinuria. When tubular proteinuria occurs alone, albumin excretion is only slightly increased. So, in acute tubular proteinuria may occur with burns. Chronic tubular proteinuria occurs in the cirrhosis of liver. We know the condition of burns. In the burns condition, what is happening? The patient's skin may be destroyed when he was undergoing extreme thermal agents. Then the third one is overload proteinuria. In overload proteinuria, overload meaning is something is excess in the patient body. So overload proteinuria is due to increased concentration of abnormal low molecular weight proteins in the plasma, such as immunoglobulin. So that is known as Bence-Jones proteinuria. For example, high plasma concentration of immunoglobulin light chain is seen in multiple myeloma. We have to see, we have to understand the concept of multiple myeloma. So what do you mean by this multiple myeloma? Multiple myeloma is a type of cancer that affects the plasma cells, which are a type of white blood cells responsible for producing antibodies. The another type is post-renal proteinuria. Post-renal proteinuria, post meaning is after something is after. So what is the meaning of this? Post-renal proteinuria is due to abnormal secretion of protein into the urinary tract. So post-renal proteinuria refers to protein arising from the urinary tract, that is below kidneys, and is usually due to inflammation or cancer. Lesions of the urethra, renal pelvis, and bladder and prostate and may be causative factors for proteinuria. What kind of proteinuria? It is a post-renal proteinuria. Then, so far we have discussed the concept of proteinuria. So let us summarize our topic. In a nutshell, we have discussed regarding proteinuria. The presence of protein in urine in excess of this is referred to as proteinuria. And what is the causes of proteinuria? The proteinuria can be caused by the major factors like increased permeability of glomerular membrane, reduced tubular reabsorption, increased concentration of low molecular weight proteins, abnormal secretion of protein. So that is also known as post-renal proteinuria. And let us summarize regarding types of proteinuria. The different types of proteinuria are glomerular proteinuria, tubular proteinuria, and overload proteinuria and post-renal proteinuria. I hope, my dear students, you understood the concept of proteinuria. Once again, I thank you one and all for your valuable contribution towards my presentation. Thank you.